This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new season of Behind the Headlines. This is our 16th year, and we're really pleased to be back. Unfortunately, Charlie Greenwald, our usual host, is on assignment and couldn't be with me today, but I'm really happy to have Dave Atkinson with me. He's an associate of the Susquehanna Valley Center for Public Policy. Hello, Dave.
Hey, thanks.
Welcome to year 16. You've been
Sweet 16.
Been around for a lot of it. Appropriately, we're going to talk about some back-to-school issues today. We have, as our first guest of season 16, Ken Mash, who is the president of APSCUF. And APSCUF stands for the Association of Pennsylvania State College and University Faculty. I got it right.
You actually did. That was really good.
So welcome to our new season, and we enjoy having you all the time, so welcome back.
Well, it's great to be back, and especially at this season when our faculty are back. It's work at school, and the students are all there, and everybody's excited about the future.
And everything's going smoothly so far?
Yeah, everything's going great. So I think, like I said, everybody really looks forward to that start of the new semester when everything's fresh. New students are on the university. There's a real life to the university, and it's filled, particularly at this point of the year, with a lot of energy.
So you must be particularly interested right now in the new Public Higher Education Funding Commission that's been developed. Can you tell us a little bit about that and what your expectations are of this new commission? Yeah,
so there's a commission. It was passed by the Senate to create this commission to look at higher education funding. I know that among other things, they're going to look how money is allocated in the public higher education sector to see how funding should be distributed. And so they're going to look at all kinds of things like funding formulas and also breakdown and perhaps some performance funding, which we're not real excited about.
What's performance funding?
Well, performance funding is when you look at certain kinds of measures like, whether it's graduation rates or persistence of students, and then you award additional money because of success there. The reason why we don't love those things is, as faculty, is because they tend to punish students for behaviors perhaps of administrators. So, why should it be that a university should get less money, have less money to spend on its students, because maybe things are not being done well at the university? So we have some concerns about that kind of performance funding, but our biggest concern about that is just simply the fact that public higher education in Pennsylvania is severely underfunded. And so, just moving things around is not really the solution. People have to take a hard look at Pennsylvania's commitment to this generation and say, are we doing things appropriately? The data shows that almost every measure, Pennsylvania is 47th, 48th, 49th, 50th when it comes to funding. And the U.S. News and World Report ranked Pennsylvania 50th among the states when it comes to higher education. That's not a situation that's going to lead to success. It's not going to lead to success for us to be able to provide for opportunities for working class Pennsylvanians, and we're already seeing how fewer students are able to afford to go. It's not a recipe for success when we're 49, 48, 49, 50 when it comes to measures regarding student debt. And we have students who are graduating, and instead of doing things like buying cars and buying houses and planning for the future, instead they're just giving money over to banks. And that's not good for our economy, which has an impact on every single. Yeah, their parents has an impact on every single Pennsylvania. In fact, I think it's people 50 and above are the people who are the fastest growing rate of debt. And that comes both from people returning to college to get upskilled, but it also includes people who are signing off on their kids or their grandkids on their loans. When their kids or grandkids can't repay those loans, they're suddenly on the hook and have to make choices about things like, will we pay property taxes or will we pay back the bank for this loan, and it's just not a healthy situation. And I think this is something that actually started many years ago, where we started cutting back on the amount of money that we give over to our universities. And in 2011, there was a big cut, and we've never really recovered from that. We're happy that the governor and the legislature have added money, but it has not in any way made up for the money that we had lost in the past. And in real terms, we're getting like the same amount of money we got 20 years ago, and that just does not work.
What are the expectations of this commission? I mean, what were they tasked with? What's their time frame? How are you going to be involved in the commission's work?
Yeah, from what we understand, I think they have like almost a year to do their work. They're getting started. I think even as we speak, they're starting their work. I think the expectations for them is to do something similar to what was done with K-12 education,
right,
to come up with a funding formula of some sort. But like I said, they really must, we feel, cope or deal with this question of, what is Pennsylvania's commitment to this generation?
Well, in a way, it seems it presents an opportunity for the universities and for the people who make up the universities to educate legislators, particularly, as to what's happening on the various campuses. When I watched the budget hearings last spring, and people were saying, well, these schools aren't doing very well, their enrollment's dropping. Well, that's a demographic problem that faces every institution. It's not reflective of the performance of the state universities. And when you look inside the universities and you see what they're doing in terms of keeping students there, in terms of partnerships with the local communities, in terms of making research part of the program, and you see what the faculty members are doing beyond the job description to involve the students, to help them get full value for their time there. I think that's all part of the story that has to be told in terms of, look, this is more than just rearranging the money, as you say.
Yeah, our universities, when we compare them to similar universities across the country, do very well when it comes to graduation rates. When it comes to retention, we could always do better, and we strive to do better, but they perform really well. We set it. In recent years, we've set records for degrees conferred on students. So we're doing the work. It just makes it all that much more difficult. And you're right, there's been a decline in the number of high school graduates in Pennsylvania, and that's impacted every college and university in the Commonwealth. But what we see is that we are losing students disproportionately from the bottom 40% in terms of family income, which tells us that these tuition, I think since 2000 they've gone up, they've doubled tuition and fees. And so, it's elastic. The tuition is elastic, which means that as it goes up, fewer people can afford to go, and financial aid doesn't keep up. And it means either taking out these massive loans or just not going. And people need to remember, too, that depending on your economic situation, we might sit here in our position and say, you might leave $40,000 in debt, but, that might be manageable. But if your family income's at $60,000 a year, saying you're going to leave with 30, that looks like Mount Everest. So, everything is relative for people, and I think more and more people are making those hard choices.
So you mentioned just briefly that the budget season this year did net an increase in funding for the universities. Can you tell us a little bit more about that? I imagine you're already getting geared up for next year's budget season,
right,
for more money. What are you looking for in this as the General Assembly is back this fall?
So there's an increase of 2%, which I think translates to about $9 million for the universities. That left, I think, the universities like $60 million or something short of what they said they needed to be able to do well during the year. So we're starting to see budget cuts at all of the universities. I know one university just got notice that all the budgets for all the departments cut 50%, and while they're struggling through this circumstance. So, you get to a certain point where, you just can't cut it anymore without doing significant damage to the university. And there was a study done, in I think 2012, 2013, which talked about why do students come to our universities. And they come because of the price, the cost, because it still is, even now, relatively inexpensive. And they come because of the range of programs that exist. So under with these difficult budgets, what we've seen is costs have gone up and the amount of programs is starting to shrink down. So, the very things that attracted students to our universities are being harmed by the state's lack of commitment, really, to public higher education.
It's funny, there seems to be a sort of disconnect. So when we have business folks on the program, they say, we have trouble finding trained, reliable employees. And when we have educators on the program, they say, well, there's a lot of people who complain they're getting degrees, but they're having trouble finding work in the field for which they studied. And it seems that the employer community and the education community need to connect better so that the people who are coming out with degrees are suitable for the jobs that employers have to offer.
Yeah, I mean, we, not to contradict too much what they're saying, but our students do find jobs. And they most often find jobs in the area that they studied. It's a little bit different if you take, if your major is in humanities or social science, because there is not a direct connect path to what your job will be. But nevertheless, people succeed. Ultimately they succeed. So, we need to educate people, but we need to make that education affordable. And we need to stop acting like, and too often I hear this, that no, we need to spend our money on training for technical skills and things of that sort. Well, look, if Pennsylvania is going to succeed in the future, this is not a zero-sum situation. We need to be able to provide quality institutions, four-year higher education, community colleges that are available and affordable for students, and we have to be able to provide for training for people too. This is not a situation where you do one at the cost of the other. We have to do all of it, and particularly if we're trying to attract the good jobs of the 21st century, which are going to be high-tech and require advanced skills, we're going to need to do more to make sure we're providing for that.
Well, Ken, we want to thank you so much for being here today. I think we're going to definitely have to have you come back so you can report on the Commission's work. I think it's going to be interesting to see where this goes in the future. So thank you so much for being here today.
Thank you. It's always great to be on.
Stay tuned for the next segment of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Pennsylvania State Association of Township Supervisors, the largest, most influential municipal association in the Commonwealth. Since 1921, PSATS has been preserving and strengthening township government and securing greater visibility and involvement for townships in the state and federal political arenas. Covering 95% of Pennsylvania's land mass, townships represent 5.5 million residents, more than any other type of political subdivision in Pennsylvania. Behind the Headlines is also brought to you by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Welcome back to our show. And joining me today is Warren Kampf, Senior Vice President of Advocacy and External Affairs for the Hospital and Healthsystem Association of Pennsylvania. Welcome, Warren.
Thanks, Dave.
You are relatively new to the organization, and it is a new position that has been created. So why don't you tell our viewers a little bit about what you're doing and what you're learning?
So I am the Senior Vice President for Advocacy and External Affairs. And essentially what that means is I'm responsible for advocating on behalf of hospitals and our patients with the state government and also the federal government in Washington, although we have some help in both places. And then external affairs, I'm responsible for the communications of the Hospital Association, our emails and social media to our members and to the general public, and then our internal communications. So it's a big job, and I'm 4 months in. I think I'm doing okay.
Well, as a former state legislator, you were probably well familiar with the different kinds of healthcare facilities in various communities and the laundry list of issues that hospitals have to confront budgetarily, legislatively, and from a regulatory perspective.
That is true. I mean, I was on the Appropriations Committee in the State House for 6 years, 3 terms, so I got to know some hospital funding issues while I was there. And then I also worked on some liability issues as a former defense lawyer. I brought that to bear in the state government. So I know something about it, yes.
Yeah. Well, as you know, one of the issues of great concern in communities all across Pennsylvania, because every community is affected in some way, is the opioid crisis.
Yes.
And it's one where everyone has contributed in some way to the problem. It's built up over a long period of time, and so there are all kinds of solutions being implemented to carry it out. What role do the hospitals and other healthcare facilities have in helping to turn this around?
So we're right now playing an exciting and a new role in trying to combat the opioid epidemic. I don't know if you've heard about this, but we have what's called a Learning Action Network, a LAN. And we're doing this thanks to the generosity of the Bloomberg Foundation. We and a couple of other organizations in Pennsylvania applied for a grant to conduct this Learning Action Network. So essentially what it is hospitals sharing what they are doing, learning from their colleagues around the state in other hospitals, what works and what doesn't work. It's a 2-year process. There's of course going to be data and reporting. There's going to be best practices that comes out of it. The 2 main goals are of course to reduce or eliminate opioid overdoses, and also get people who come through our doors or come across our radar screen, get them into proven evidence-based treatment. We're very excited about it. We just kicked it off last week actually, and we think it's a great example of what hospitals are now contributing to that discussion.
Okay, and give people an idea of the scope of what's intended. So when you give money from an outside foundation, you obviously put together an application. You say, here's the locations where we're going to be doing this. Here's how many people we hope to serve. So can you give people who are watching some idea of the scope of this effort?
So there are 120 hospitals that have already signed up to participate in the LAN around the state. That's more than half of the hospitals, and we're going to keep adding them. Johns Hopkins is actually kind of the monitoring and reporting entity that's going to be watching, observing, recording, and drawing conclusions. We're also partnering with the emergency physicians of the state. So the scope is very large. There'll be local, regional meetings. There'll be a coming together and a sharing statewide, and of course a reporting process.
When people talked about safety in connection with healthcare facilities, going back 10 years ago, it was patient safety. That was what we were all about and everything. You mentioned safety these days, and we think of it in terms of the workers in an institution, where whether it's a threat coming from the outside or from the inside. And so what kinds of things are hospitals and other healthcare facilities looking to do these days in the name of worker safety?
So this was something, Dave, we talked about my transitioning from the state legislature, that coming to HAP was very surprising to me. But the national statistics on workplace violence for hospitals and healthcare providers are really shocking. In the last few years, those numbers in healthcare settings have increased by 75%. Healthcare workers occupy about 15% of the workforce of our country, and yet they account for 65 or 70%, about 60% of the workplace violence, right? So it is unfortunately the sort of thing that we absolutely have to pay attention to. We have to make the workforce in our hospitals feel comfortable so they can do what they want to do, which is care for our patients. We have two pieces of legislation pending in the state legislature, both in the House and in the Senate. Senator Judy Ward has a bill that would make an assault of any kind, not an aggravated assault, but an assault of any kind on a healthcare worker a felony, obviously with much higher penalties associated with it. And then there's a bill that's something you wouldn't think about, but it's very important. We call it the name badge bill. Pam Schneider, the state rep for Mountain Green County, has this bill. And I don't know if you know, but it's a state law that you have to have your first and last name on your badge in many of the settings in a hospital if you work there. The problem we've learned is that people in this day and age are stalking with those names, going online, unwanted contacts, right? In this day and age, that sort of thing is very real. And so this bill says you do not have to put your last name on your badge. Would seem like a simple thing, and we're going to try to get to the governor's desk in the next couple of months.
It's amazing how habits have to change in regard to the kinds of threats that we face today. And I know when you go into a hospital, we've now become accustomed to seeing, in addition to all the medical personnel, security personnel, because you need to do that for safety purposes. There's a lot of attention paid to the hospitals, and we have a large number of different size facilities across the communities of Pennsylvania and everything like that. I think that people shudder when they see headlines, and you're coming out of the Southeast, so you know the headlines that have attended to the Hahnemann situation in Philly, and I think there's a message there that to many people, it's the idea that, well, geez, we only miss them when they're gone, and that it's a long process by which a facility gets into trouble, whether it's economic trouble or whether the neighborhood has changed or whatever it is that contributes to the closure. So how are you getting out this message to people and to organizations and to communities to love your hospital, because you want us to be there when you need us?
Well, one thing we know, because we do sometimes come across surveys, this is done out in the community and polling and that sort of thing, people do love their hospitals. If you ask most citizens in a community, in a neighborhood, they look to their hospital as a place where good care is given, and where leadership is provided for the benefit of the community. So we're fortunate to have that. That's because of the kind of care that our members provide. One thing that people really need to understand, however, is a lot of hospital care is paid for with government payors, right? With the Medicaid program and the Medicare program, right? And Medicaid, I think maybe 1 in 5 Pennsylvanians is on Medicaid, so it's a vast, vast system. That's a couple, 3 million people, right? Medicaid only reimburses on average in Pennsylvania about 80 cents on the dollar of cost, not of profit, but of cost. So trying to run any organization where it costs you $1, but you only receive 80 cents is next to impossible. And that's part of the fabric of closures and units being closed, happening whether it's in a city like you mentioned or in rural areas. Medicare isn't a lot better. It's, I think, in Pennsylvania about 94 cents on the dollar. So that's a message that we need to continue to deliver to our policymakers and also to consumers. But another thing is that we're working on their behalf, David. We have a robust fall agenda of items that we're working for that are going to make it we think, easier to do exactly what our members want to do, which is care for patients. And I'd certainly love to talk about that too.
Yeah. Well, we could spend a lot of time on it, but the Medicare, Medicaid reimbursement problem that you say is particularly acute in some of the small communities in the rural areas. And for once, we see Pennsylvania, in cooperation with your organization, pursuing a rural health model initiative that is a different way of doing business to try and keep those doors open.
Right, and you know what, that is such a great program in Pennsylvania. Is the pilot state for this concept you just mentioned in the whole country. So the eyes of the nation are on us. The idea is for rural hospitals, if they're just doing fee-for-service with often a Medicaid or a Medicare patient coming through the door and not a lot of private insurance that might pay at a higher level, are there ways to provide reliable, consistent, similar level payments from month to month so that these rural hospitals, critical access hospitals, can make it through the year, can properly budget? We've got several of our hospitals around the state signed up to be in this pilot. There are others that have expressed an interest. Of course, the devil's always in the details.
Yeah,
right?
absolutely.
Right? But that pilot we're excited about, and there's some state level attendant legislation that goes with it. So that's something that's great. A couple other things that maybe you followed. We're working on telemedicine. We're working on venue. Any interest in maybe talking about those?
We've been there, and we'll be back to them. One of the things that's great about this whole menu of issues is that there's always going to be a next show, so that we'll have your colleagues back on so we can update them on some of the issues we've talked about and talk about the progress on the other issues you've brought up. And
all right.
So thanks so much for joining us. It's good to see you in this new role, and we wish you all success.
Thank you.
We look forward to you joining us on our next edition of Behind the Headlines.